In this video, I explain to you what PTSD is and how it can affect people. You will learn which symptoms may appear and what to do if someone has PTSD. PTSD stands for post-traumatic stress disorder. It occurs when a person experiences a very traumatic event that they cannot properly process. This could be an accident, a natural disaster, or even an assault. PTSD can lead to persistent psychological distress. People with PTSD often have flashbacks, where they relive the traumatic event again. They may also have nightmares, and constantly think about the experience. Symptoms also include sleep disturbances and irritability. In some cases, those affected avoid places or situations that remind them of the trauma. PTSD usually develops due to extremely stressful events. These experiences can overwhelm the psyche to the point where it can no longer be properly processed. Common causes are experiences of violence or unexpected disasters. Repeated traumatic events can also increase the risk of developing PTSD. The diagnosis of PTSD is made through conversations with a psychologist or psychiatrist. The specialist asks about the experiences and symptoms. Psychological tests are also conducted to assess the severity of the disorder. Often, diagnosis takes some time because symptoms may develop slowly. Treatment for PTSD mostly involves therapy. Especially helpful is cognitive behavioral therapy. Here, those affected learn to recognize and change their negative thoughts. Sometimes medication is also used to alleviate the symptoms. People with PTSD often need a lot of support from friends and family. An open conversation can help process the experience. It is important not to pressure those affected but to give them time. Support from the social circle can significantly promote healing. PTSD can greatly change the daily life of the affected person. Often, those affected find it difficult to carry out their daily activities. They may be limited in their work or school. Social contacts can also be affected by the symptoms. In the long term, PTSD can lead to serious psychological problems. Those affected have a higher risk of depression, anxiety disorders, and addiction problems. Without treatment, PTSD can severely impair quality of life. Therefore, it is important to seek help early. Not everyone who experiences traumatic events develops PTSD. Some people are better able to cope with stress. Important factors are good emotional support and a stable social environment. Stress management techniques can also help prevent the development of PTSD.